Starting with the introduction of enzymes, their whole purpose and their functions is to speed chemical reactions that occur in the body, and they act as a biological catalyst when doing this. And they also bind to structures and alter them. So for an example, the RAS system, where renin turns angiotensinogen to angiotensin 1, and then later in the process when ACE turns angiotensin 1 to angiotensin 2. They also play a role in the body's metabolism, digestion, respiration, muscle and nerve functions, and DNA replication. Collagen is a fibrous protein that's present in a lot of places in the body, and these places are like the skin, tendons, blood vessels, cartilage, bone, cornea and vitreous humor of the eye, and the basement membrane. So based on how many places it reveals itself in the body and its function, which is to provide structural integrity and support to tissues and organs, it's easier to understand that when you have a disorder, how much it impacts the lifestyle of the patient.
Tay-Sachs is an enzymatic disease that occurs due to a mutation on the hex-A gene, where coding for developing an enzyme called beta-hexaminidase is located. This enzyme is responsible for breaking down a naturally occurring lipid called GM2 gangliosidosis. Since this mutation stops or severely slows its production, this lipid accumulates rapidly in areas of the brain and spinal cord, causing widespread nervous tissue damage. As you might expect, this causes a whole host of problems, such as seizures, paralysis, muscle spasms, blindness, difficulty in speech, and a general decline in cognition. The severity and onset of these symptoms occur according to the degree the enzyme production was slowed, allowing for infantile onset, juvenile onset, and late onset, with the latter being both the least severe and least common.
Currently, we don't have any treatments that effectively help treat Tay-Sachs disease, but there was a study done in 2018, just in September, so it's pretty recent. And what the researchers did was they took these pluripotent stem cells from people with Tay-Sachs disease, and they induced them to become differentiated into the neural stem cells. And they basically mocked what the neural cells do in a person with Tay-Sachs. So they displayed lipid accumulation. And then they used those cells to evaluate the therapeutic effects of enzyme replacement therapy. So with enzyme replacement therapy, you're basically giving the patient the enzyme that they're missing that causes the disease process within the body. And what they did was they tried giving the recombinant hex-A protein as well as smaller molecular compounds, HPBCD, and alpha-tocopherol. And they saw a reduction of the lipid accumulation in the cells that they had induced to become the neural stem cells. So the big takeaway from this study was that the Tay-Sachs disease neural stem cells can be used as a cell-based disease model to study disease pathology and perform compound screening for drug development. So we can continue to look into ways to treating Tay-Sachs.
Many enzymatic disorders are early onset and therefore affect a large population of infants and young children. Because of this, there are many ethical considerations that we must take into consideration when choosing treatment plans and new techniques, such as taking into consideration their quality of life and comfort.
The cost of enzyme replacement therapy has been researched to some extent with the rare Pompe disease. ERT has proven to be effective in improving quality of life and lifespan by 8 years on average. However, with the frequent dosages needed, the cost per additional year of life is about $1.9 million. For some countries in Europe, this treatment doesn't meet their minimum cost effectiveness, so the treatment is not covered by their health care and would have to be paid out of pocket.
When studying this concept, it's important to understand that as of right now, collagen and enzyme disorders are not curable, but they can be managed. And as nurses, we're working with these patients to better their ways of living with these disorders. And so being able to recognize and formulate an accurate nursing diagnosis is critical in approaching quality management. And early interventions and implementation will help to slow the development of progression and further complications. And the last is understanding the physical and emotional stresses of these disorders will help the nurse provide better patient-centered care, which is our whole philosophy, which is incredibly important when caring for a patient.